To me, there are kind of three core methods that I like to use to kind of understand what someone's aesthetic goals are and then to communicate to them what I think is reasonable given their anatomy and what's kind of surgically possible. And the first thing is in-depth conversation, right? So any of these kind of adventures starts with a long, in-depth consultation where we go through your medical history, your social history. Have you had any kind of surgery before? We go into what you're looking for, even why you're trying to do it. Motivation is very important. Um, and then the next thing we do is I often like to see wish pics. So if someone's coming in for
What's a wish pick?
a wish pic is what you wish your picture could look like afterwards, right? So
Okay, I have a few.
yeah. So I mean, if someone's coming in for a breast augmentation, it's great if they can bring in a couple models and they say, I really love the way that these look. And it's important for me as the surgeon and the patient to take that with a grain of salt because pretty much everything you see in a magazine or online is airbrushed in one way or another. But it certainly gives me an idea of what the goal is. And kind of the third step here is, again, just carrying the analogy or the example of breast augmentation, is I like to do 3D modeling. So we can build a kind of extremely accurate 3D model, full color of our patient. It's photorealistic. We have a virtual catalog of every breast implant available in the United States.
Wow.
Yeah, and we can put them in and we can say, this is what this would reasonably, approximately look like on you. So that can kind of give us a sense of how reasonably we can approach the aesthetic ideal that's been kind of communicated by the patient.
That's so cool.
Yeah, it's neat. It's a fun process.